Let's bring in our headliner today, Health and Human Services Secretary Alex Azar. Mr. Secretary, good morning and welcome.
Good morning. Good to be with you.
Definitely a lot to get to with you here. First, I know that you have a new announcement to make on the ongoing preparations being made. What exactly is that?
Well, we're bringing in the Grand Princess. It's going to dock today, as well as start offloading passengers from that ship. They're going to be offloaded in a way that protects, first and foremost, the community, and secondly, protects those individuals. They'll be in an isolation quarantine environment. They will then go to facilities that we've arranged around the country for their own care. They will be tested. They'll go into 14-day quarantine. We're going to be leaving the crew on board the ship, although we're surging medical staff. We already have put people on board the ship to isolate those individuals, make sure appropriate isolation and quarantine is happening on board that ship. And we're working very closely with Governor Newsom and the mayor of Oakland on all of these efforts.
There's criticism, obviously, of the federal effort here, and I just want to get from you. Do you feel like your department, that the federal government and your department have their arms around this crisis?
We've been on this from day one when we first got word from the China CDC about this, and have been working aggressively to prepare this country for what we see as a very serious public health threat. We'll take all actions necessary to protect the American people, working with our state and local partners. We've gotten a diagnostic out there. That diagnostic is in the field. It's available for our public health labs, our hospitals. So over 1 million shipped over the weekend. We now have 2.1 million available for use in the United States. So testing is fully available to our providers. We've rapid work on a vaccine that should go into clinical trials very soon. We have a therapeutic already in clinical trials. We've taken historically aggressive border patrol and border control measures to protect the American people, and we're going to keep taking very aggressive steps to protect America.
Mr. Secretary, there's a lot to break down there as far as the vaccine and the timing of that vaccine, because there also seems to be mixed communication on that. But if I could turn everyone's attention to the Dow, because we've been watching the U.S. stock market since it opened for trading just over an hour ago, and right now there is a significant sell-off happening on Wall Street, more than a 5% drop on the Dow. It is a 1,380-point drop due in part to coronavirus fears. So does the administration feel like it has put out a confident message and one easily understood by the American public to limit those fears, because they are significantly playing out in our stock market this morning?
So President Trump has delivered a historically strong economy, whether it's on unemployment numbers or on productivity, and he's going to keep doing that. But his number one concern across the whole of government, along with Vice President Pence, is leading the public health preparedness and response effort here. Our economic team will work on economic aspects of this, and President Trump, having delivered the best economy in modern history, has the tools and knows the tools to keep this economy going.
Did he have
but his
anything
first
to say
focus
about
is public health.
Did he have anything to say about that stock market sell-off this morning?
I haven't spoken to the president yet this morning.
Okay.
The president in the air right now, as we understand it, having just taken off from West Palm Beach a little while ago. Listen, Governor Andrew Cuomo, obviously Democrat of New York, has been critical of the federal effort. Here's what he told Maria Bartiromo.
Look, testing is limited, and this is, I think, Maria, one of the main issues we have, both in reality and in perception. When you wonder why people are so anxious and the fear, it's because the information they're getting tends to change, and they're getting mixed messages.
How do you answer that last part in particular? Mixed messages, says Governor Cuomo.
Well, listen, I'm disturbed by that comment, because Governor Cuomo has actually been a really good partner working with us. So I'm confused by what he's saying there, because New York State and New York City have all the lab tests they've asked for. In fact, we've offered them more, and they've refused further shipments of lab tests. So there's just no factual basis for what he's saying there. But he's been a good partner, and we're working really closely with the New York City Public Health Department as well as with New York State. We actually approved over a week, I think a week and a half ago, we approved New York, maybe a week ago, New York State's a lab test that they developed and that we actually approved. So they've been up and running with capacity for any need they've had. Let me be really clear about one point. There has never been a time since the CDC developed the lab test that any public health official in the United States who needed to get somebody tested for the novel coronavirus has been unable to get that person tested through the CDC's test in Atlanta. We have had capacity and throughput at every moment since we developed this test. That is a fact.
Secretary Azar, Fox News is just now reporting that the White House has made the decision to limit certain in-person meetings because of the growing spread of the virus. According to a senior administration official, the White House and the State Department are discouraging foreign officials from coming to visit, instead opting for phone calls and video conferences when possible. Can you confirm that?
Well, I don't have all the details. I'm sitting here with you as any announcement like that's been made, but we're going to take steps just like private industry to ensure protection of our people and to mitigate the spread of disease, take appropriate, reasonable steps. You know, we're working right now, the CDC is embedded in the state of Washington with Governor Inslee and in California with Santa Clara County, where we're advising them on future mitigation steps to take, including social gatherings, to especially protect those who are elderly and those who are medically fragile. As you talked about in the opening here, there is a certain cohort of individuals globally that are most at risk from severe and critical medical conditions as rising out of this novel coronavirus. And we need to take extra protections in those environments to ensure infection control and for those individuals to stay away from settings that put them at greater risk.
Secretary Azar, there's also confusion about the coronavirus. If you could, we talked about this last hour, and we said we would ask you. The coronavirus has been around for some time. It's the COVID-19 strain of the coronavirus that has caused all of these problems. What is it about that strain, and what makes that so different than the coronavirus that has existed?
Yeah, so there's a normal coronavirus, a couple of strains of it that exist and have existed for a long time out in humanity. Our bodies are used to dealing with them. They have a known profile in terms of morbidity and mortality, and and people are used to dealing with that. SARS, MERS, and now COVID-19 are genetic modifications to that virus that the human body is not used to dealing with, does not have any type of response mechanism built in for it, and has a particular severity, a mortality and morbidity profile different from the common cold. And as we talked about, in particular, what we're seeing is the elderly and individuals who are medically fragile are most at risk of severe and critical complications from the disease. Fortunately, we're seeing that while children and younger individuals can get the disease, globally the data seems to be indicating that they are less at risk of severe or critical complications from the virus. But we're continuing to learn every day, and we're continuing. President Trump is going to insist that we take aggressive measures in a whole-of-government approach to protect the public health here in the United States as our first
Secretary,
priority.
so we've only got a couple seconds left, but we hear you putting out a confident message, one where you say that the messaging is coming from the White House is accurate and all-inclusive. We also hearing you say that despite what we've heard from other administration officials, if you want a test from the CDC, you will get a test. Nobody's being denied that. What is your biggest challenge, your biggest struggle right now in all of this?
Our biggest challenge right now is to ensure that we contain further spread into the United States and that we work with our state and local partners to mitigate spread in areas where we've had community spreading. So that's working with Governor Inslee, that's working with Santa Clara County, it's working with New York State and City, it's working with Florida. To take the aggressive measures needed to slow down the spread of this disease so that we can always continue to buy time and mitigate the impact here in the United States. But make no mistake, this is a very serious health problem. Nobody is trying to minimize that. It is a very serious public health threat to the people of the United States, and that's why President Trump from day one has been aggressive with a whole-of-government approach and will continue to do so.
I know I said last question, but one more. There are schools open all over the country. Some have decided to shut down as a precaution. Do you recommend any further school closings at the federal level, Secretary Azar, based on what you are seeing and hearing, especially considering the White House is now limiting in-person meetings?
So we haven't recommended that every single community in America close schools. We're working with individual communities based on the data in their community and what cases they have seen. In some communities, closing schools is a very appropriate measure. In others, it might be having school, but limiting assemblies and larger gatherings within the school. So it's very much a local and state decision about the approach to take based on data. We're there to help and advise them.
Alex Azar, the Health and Human Services Secretary. We know you're a busy man. Thanks for spending some time, right?
Appreciate it. Thank you.